the dream of surgical perfection is a powerful drug. We are sold a vision of seamless transformation, of erasing flaws with the precision of a magic eraser. But behind the glossy after photos and the nonchalant social media influencers lies a far grimmer reality. The operating room is still a room where biology fights back, where human error has catastrophic consequences, and where the pursuit of beauty can lead to a waking nightmare. It is estimated that millions of procedures happen globally every year, yet the number of unfavorable results remains a closely guarded secret until the lawsuits begin. Here is the story of when the scalpel goes rogue, told through the lens of 20 horrific cautionary tales. The most terrifying headline in modern aesthetics belongs to the Brazilian butt lift, or BBL. This procedure, which involves taking fat from one part of the body and injecting it into the buttocks, has become infamous not just for bad results, but for death. According to data presented to the British Association of Aesthetic Plastic Surgeons, BAPS, the mortality rate is as high as 1 in 3,000 operations, making it the deadliest cosmetic surgery in existence. The mechanism of death is horrifyingly simple. If a surgeon injects fat too deeply, it can pierce a large vein. That fat travels directly to the heart or lungs, causing a fatal pulmonary embolism instantly. 1 minute you are on the table seeking curves, the next, you are gone. This has led the BAPS to urge a moratorium on the procedure until safety data improves, though many high-volume budget clinics continue to operate with frightening laxity. When surgery goes horribly wrong, it often doesn't happen in a sterile, world-class hospital. It happens in a strip mall. A joint investigation by KFF Health News and NBC News exposed a disturbing trend of national cosmetic surgery chains hiring physicians with troubled pasts or the wrong specializations. Take the case of Erin Schaefer, a 37-year-old who went to a Sono Bello clinic for liposuction and a mini tummy tuck. The surgeon assigned to her was not a plastic surgeon, but a board-certified OB/GYN. The procedure, performed while she was awake, was so agonizing she reportedly begged the doctor to stop. Days later, her wounds dehisced, and she suffered a severe infection. Because the doctor was an OB/GYN without admitting privileges at a local hospital, he couldn't even arrange the emergency surgery she needed. Stories like hers are not anomalies. Court records show this chain alone has faced over 60 malpractice cases and 4 wrongful death suits since 2013. Even when the surgeon has the right credentials, the chemical interactions in the patient's body can create a perfect storm of disaster. A 2025 case report published in Plastic and Reconstructive Surgery detailed 2 female patients who underwent standard abdominoplasties. Both were non-smokers with no obvious risk factors. Yet, both developed terrifying necrosis, their abdominal skin dying and turning black. The culprit? A biologic migraine medication called fremonezumab. These drugs, used by millions for migraines, block a peptide involved in blood vessel dilation. In these patients, the drug essentially choked the blood supply to the healing surgical flap, turning a routine tummy tuck into a gangrenous reconstruction. It was a hidden interaction that no Instagram ad could have predicted. One of the most shocking elements of these disasters is the sheer unpredictability of the human body's reaction to foreign materials. A systematic review of facial implants published in the National Library of Medicine analyzed over 4,000 patients and found that while complication rates are relatively low, when they hit hard. Nerve injuries occur in over 2% of cases, and infections can ravage the face, requiring the removal of expensive, custom-milled implants. We tend to think of silicone and polyethylene as inert, but the body often sees them as invaders. In many of the 20 times, the horror wasn't the initial cut, but the creeping realization months later that the implant was shifting, eroding the bone, or becoming a reservoir for a chronic, deforming infection that turned the patient's face into a war zone. The legal system is often the only mirror held up to this industry. In Washington state, a jury awarded over $13 million to a woman who underwent a mommy makeover, a tummy tuck, arm lift, and breast lift, only to be left with permanent disfigurement and persistent infections. The court heard testimony that the surgeon packed multiple major surgeries into a single week, that the patient was medicated before signing consent forms, and that the clinic's advertising minimized the risks of scarring. The Washington Court of Appeals upheld the verdict in 2025, noting that the surgeon's failure to screen for the patient's diabetes and smoking habits represented a gross deviation from the standard of care. This case represents one of the 20 times where the horror was not just physical, but financial and emotional, a lifetime of revision surgeries and trauma. Traveling abroad for cheaper surgery has created an international crisis of morbidity. The BAAPS conference highlighted a specific, alarming phenomenon: surgeons in the UK are seeing a six-fold rise in botched abroad patients. One case involved a woman who returned from Turkey with a piece of latex glove sewn inside her buttock. Another suffered from necrotizing fasciitis, the flesh-eating disease requiring nearly $60,000 worth of NHS care to save her life. These patients often believe they are getting a bargain, but they return home as walking emergencies, their bodies rejecting industrial-grade fillers or fighting infections from non-sterile environments. The horribly wrong moment for these patients often happens on the flight home, when a DVT breaks loose, or when they unwrap a bandage to find rotting flesh. However, perhaps the most insidious disasters are the ones that happen in plain sight due to hubris. The facelift, or rhytidectomy, is seen as the gold standard of rejuvenation, but a 2025 systematic review in the Annals of Plastic Surgery notes that while hematomas are the most common complication, unfavorable scarring and neuropraxia, nerve damage, are rising. A bad facelift doesn't just make you look older, it can paralyze half your face. It can pull your hairline back into an alien peak. It can leave you with a windswept look that screams surgical tragedy from a mile away. These outcomes are often the result of surgeons chasing the latest technique without respecting the fundamental anatomy of the facial nerves. Then there is the psychological trap of the revision. Many of the 20 patients on this list did not go to a surgeon just once. They went back to the same butcher to fix the asymmetry, the lumpiness, or the crater. The case of the 23-year-old breast augmentation patient cited in medical liability reports is a classic example of chasing a mistake. The surgeon tried to fix asymmetry by adding 105 cubic centimeters to one side, only to create stretch marks and further distortion. This is the sunk cost fallacy of surgery: patients so desperate to look normal that they allow the surgeon to compound error upon error until they are left with a chest that looks like a patchwork quilt of scar tissue. The common thread in these 20 stories is not just bad luck, it is the deregulation of the medical spa and the normalization of high-risk procedures for profit. From the OBGYN performing tummy tucks to the use of untested migraine drugs, the industry is moving faster than the science. We see the perfect results on TikTok, but we rarely see the woman who cannot close her eyes because a blepharoplasty took too much skin, or the man who cannot lift his arm because liposuction damaged his motor nerves. These 20 times are just the tip of the iceberg, the cases that ended up in court, in medical journals, or in the morgue. They serve as a brutal reminder that cosmetic surgery is still surgery, and when it goes wrong, it doesn't just go wrong, it goes to war with your very humanity.